In today's video, we are going to discuss regarding Betty Neuman's theory, application in nursing process. So we are going to see how to apply this Neuman's theory in nursing process. So already in part 2 video, we have discussed regarding the meta paradigm, that is how Neumann has viewed nursing, health, environment, and the patient. Now, just to have an introduction to this nursing process. According to Neumann, nursing is concerned with the whole person. So it is not that she is looking only to the physical aspect or only to the psychological aspect. So she, in her theory, has specified that it is a holistic perspective. So she is concerned with the whole person, and she is concerned with all the variables affecting an individual's response to stress. See, we have discussed in Neumann's theory that Neumann has given more importance to stress and the stressors. I hope you remember there are three types of stressors: intrapersonal, interpersonal, and extrapersonal stressors. So in nursing process, we should remember that we have to include these three stressors: intra, inter, and extrapersonal, as applicable to that particular patient. So she is concerned with all the variables affecting an individual's response to stress. Again, variables, I hope you remember that they are physiological, psychological, socio-cultural, spiritual, and developmental variables. The primary aim of nursing is the stability of a client system. That is, the patient should come back to the stability. Stressor stability. Okay, and this stability is achieved through nursing intervention. So how does a patient come back to a stable or a stability? It is through nursing interventions. Again, in nursing interventions, there are three types: primary, secondary, and tertiary. So, in a nutshell, we can say that Neumann has viewed a nurse as a person who is giving importance to the comprehensive care of the patient. Comprehensive means she has to assess the variables, she has to assess the stressors, that is the intra, inter, and the extrapersonal stressors, and then she should help the patient to come back to stability. And how the stability is achieved? It is through her interventions. So the interventions, the best thing about an intervention in Neumann's theory is she has given an importance to the word prevention: primary, secondary, and tertiary prevention. Now let us go directly to today's topic, that is steps of nursing process according to Betty Neumann. So according to Betty Neumann, Neumann has told only a three-step nursing process. I want all students to give importance to this specific point which I am telling now. According to Betty Neumann, there are only three-part nursing process. Okay, for her, if you're going to see, nursing process is only three-part. That is, the first one is nursing diagnosis, the second one is nursing goals, and the third one is outcome. So what are the three steps according to Betty Neumann? The first one is nursing diagnosis, the second one is nursing goals, and the third one is outcome. But if you're going to see our conventional nursing process, we have a 5-step nursing process: assessment, nursing diagnosis, objective, intervention, and evaluation. Now these things are clubbed, okay, in Neumann's theory. Assessment and formulation of nursing diagnosis will come under the first step. Nursing goal is going to be the goal or the objective or the expected outcome, including the plan of action. Okay, so if you have, whenever we write an exam, we write plan of action. So that objective and plan of action will come under the second one, that is nursing goal. The third one is outcome. According to Betty Neumann, outcome is implementation and evaluation. So we'll discuss that with an example so that it is going to be very clear. So even before we go on to the columns of writing a nursing process, If you're going to see in Betty Newman's theory, I told you that nursing diagnosis is assessment and formulation of nursing diagnosis. Now, Betty Newman has prepared one extensive format only for assessment. Okay, if you want to go through that format of assessment, it is available in nursing theory textbooks, especially Julia B. George. If you're going to see in Betty Newman's theory, she has given one what to say table. A table is there where she has listed down how to do an assessment to the patient, not only to the patient but also how to assess the caregiver based on this phenomena of stress. So I am not going to explain it fully, but you should understand that whenever we write an assessment, especially for students who are doing mental health nursing or psychiatric nursing, when you're going to write a theory based care plan in detail, first what you have to do is you have to do the assessment as per to the format given by Betty Newman. Okay, so in that format, if you're going to see, there are many parts are there. The first part is stressor as perceived by the client. What are the stressors perceived by the patient? Okay, so in that there are many headings. The first one is we have to ask the patient, what is your major stress area, or what is your main area of health concern? See how beautifully Betty Newman is trying to identify the stressor as perceived by the patient. It is not by the nurse. It is not only by the healthcare provider. Whatever I feel important, I give care. That is not how Betty Newman is viewing her nursing process. According to her, assessment should start from perception of the patient. So we are going to ask the patient, what is your major stress area? The perception. Number two is we are going to ask, what are your lifestyle patterns? How do you go about your nutrition? How do you go? What are the other things? How is your healthcare needs? Whatever we do, maybe my occupation, maybe the way I do my daily activities. So the lifestyle pattern. Then, have you experienced a similar problem? Say, for example, the patient is telling that I feel extremely tired. That is my major stress factor. Then, the question what I'm going to ask him is, have you experienced a similar problem? And what are you anticipating in the future? Okay, like what is my expectation in the future? That I'll be relieved from fatigue or I'll not be relieved from fatigue. It is because of the diagnosis which I have, I'm not going to get a cure, etc. etc. Anticipation of the future. What are you doing to help himself? What the patient is doing to help himself? That is, we are trying to assess what are his coping strategies. What are the coping strategies the patient is going to do for improving or overcoming that particular stressor, and what does he expect from others? What is this patient expecting from others? So it's a very beautiful assessment where you ask, what is your stressor at present? What are your lifestyle patterns? Okay, have you experienced a similar problem? What are you doing to help yourself? What are you expecting from others? And what are you anticipating in the future? Now, these are the stressors as perceived by the client. Next is stressors as perceived by the caregiver. See, Betty Newman is giving importance not only to the patient but also to the caregiver of the patient. So the same questions are being repeated to the caregiver. She is telling that a nurse should assess by asking the caregiver the same questions. What is a major stress area? What is a major stress area you think is according to this patient? What are his lifestyle patterns? Has this patient experienced a similar problem before? What is he anticipating in the future? What do you think the patient can do to help himself? And what is he expecting from others? Now, I get two perceptions. One is I get the perception of the patient. The other is I get the perception of the caregiver. Next, what I have to do? Then we have to find out the summary of impression. See, I have collected data from the patient, I have collected data from the caregiver. Now, what I'm going to do is I'm going to assess what gets along and what is not getting along. It's very important. Only if the perception of the patient and the caregiver is congruent, okay, a better care will be attained by the patient. Otherwise, there is a misperception between the patient and the caregiver. So, what Neuman is telling us, the nurse should assess the perception of the patient, the perception of the caregiver. If there are any discrepancies, it should be settled even before I start with my nursing care. So that comes as assessment. Okay. So in the assessment, again I am repeating, Betty Newman has given a comprehensive assessment of the stressor and the coping ability. What are the various points? The major stress area, lifestyle patterns, similar experience before. What are you doing to help yourself? What are you expecting from others? What is your anticipation in the future? So this all comes under assessment. Assessment comes under which step of Betty Newman? The first step. What is the first step? Nursing diagnosis. So to make it very clear, we were discussing about this first step, nursing diagnosis. Under this first step, there are two things. One is assessment, second one is formulation of nursing diagnosis. So in assessment, I completed this point at present. That is, we have to identify, I'll have to find out whether there is any difference of opinion between the perception of the client and the perception of the caregiver. If at all, if there is any difference, what should I do? I should attempt to resolve the perceptual differences. So I've just completed one small aspect of assessment. I hope this point is clear. So from where should I assess? I should take the format given by Betty Newman and I'm going to assess the discrepancies between the patient and the caregiver. Along with that, in assessment, I will have to find out the variables, the five client variables. I'll have to find out. So the five client variables should be assessed. What are the client variables? Physiological, psychological, socio-cultural, developmental, and spiritual variable. We have to assess. If you are applying Betty Newman's theory, that has to be assessed. The next thing is we'll have to identify the intrapersonal, interpersonal, extrapersonal stressors. So shall I put it in a nutshell? What are the three things we are assessing in assessment? Number one, I'm going to do a comprehensive assessment and find out the perceptual differences between the patient and between the caregiver. What is the second thing? I'm going to assess all the variables. What is the third thing? I'm going to assess the stressors, intra, inter, and extrapersonal stressors. The second part of the first step is to find out what is the variance from wellness. So I know now I have assessed a lot of things. From this, I am seeing what is ideal. From the ideal, what is being moved. Okay, that is nothing but our problem. We are identifying what is problem. For example, when I assess the physiological variable, I found that the BP of the patient is say 180 bar 110. Okay, now I'll have to compare it with the ideal, which is going to be around 120/80. So what variance is there? So I'm trying to identify the problem. So that is what is called as actual or potential variance from illness, which is called as nursing diagnosis. So three-part nursing process. We have completed the first part, that is nursing diagnosis. So under nursing diagnosis, we have two subparts. Number one is assessment. Number two is you're finding out the variance from the wellness. The second step is nursing goal. So nursing goal, already I have discussed with you. Nursing goal consists of two things. One is you have to formulate the objective or the expected outcome. The second thing is we will have to write down the plan of nursing intervention. So the first one is expected outcome. The next one is planned interventions. The plan of action, the planned interventions we can put it. So it's very simple. The five-part nursing process, only thing is you have to modify your care plan based on Betty Newman's theory. Then the last step. What is the third step? The final step in Betty Newman's theory, nursing outcome. So nursing outcome, what is left out in nursing process? We have completed till plan of action. So the left out is implementation and evaluation. So in nursing outcome, we are going to write the actual intervention and the evaluation. We are going to evaluate whether the expected outcome is attained. So it is very simple, no? That is the first part is nursing diagnosis, two steps: assessment, formulation of nursing diagnosis. The second step is nursing goals. Nursing goals, two step, that is expected outcome and the planned intervention. The third step is nursing outcome. In outcome, we have actual, that is the implementation and the evaluation. Now, let us see how to apply a nursing process according to Betty Neuman for a patient with multiple sclerosis. Now, this example I have taken from the internet, okay, and it is available in this ID, okay. If you are highly interested to read it, it is available free of cost in Google or in PubMed. You can take the article and you can read the full article in detail. Now, to just explain how to apply this for a patient with multiple sclerosis, let us see. So we know first we should know what is multiple sclerosis. Multiple sclerosis is a neurological disorder. Okay, the main problem is in multiple sclerosis. Whenever I study this, I always feel pity for these patients because they need lot of support. They need lot of family support. The reason is it is an autoimmune disorder. Okay, and it is going to affect the central nervous system. In the nervous system, we know that neurons are the basic functional unit of the central nervous system. But what happens in multiple sclerosis? There is demyelination. So the myelin sheath is going to be degraded, so there is going to be degeneration, and automatically the patient is going to suffer from brain inflammation, demyelination, axonal loss. So, and the most pathetic part is it usually occurs in the productive age group, that is, between 20 to 40 years. Okay, during the productive age group, this multiple sclerosis usually affects a person. So it is an autoimmune disorder. And another one thing which I would like to tell is it affects all the systems of the body. Okay, it is a multi-system disorder where a patient has to endure a lot of problems because of this particular condition. And one more problem is we don't have a complete cure for multiple sclerosis because as of now we have not found a specific drug which can cure completely multiple sclerosis. So only treatment what we can give for this patient is we can do certain strategies so that further demyelination, further axonal loss can be prevented. Only that much can be done. Okay, so it frequently progresses to disability, it has no cure, and it has a strong emotional impact on those who suffer from it and also from the family members, because when the multiple systems of the body is going to be affected, a patient, it's very normal for any human being to suffer certain emotional problems, and this is not only going to stand with the individual, the whole family is going to be affected. Now, to apply this in a nursing process, okay, so this point I told you before, the goal is to intervene before irreversible neuronal destruction happens. We can only delay it, okay, there is no complete prevention or there is no complete cure, but there are certain interventions which we can do so that the progress of the condition can be delayed. Okay, that's all. That is the only treatment available so that you can improve the quality of life of the patient. Now, we are going to apply Newman's theory. So, what are the three things I should remember when I apply this Newman's theory? Number one, in my theory, 5 variables should be there. In my theory, the stressors should be there. The perception should be there. So, perception, I am going to do it separately. Okay, now we are going to discuss about the variables and stressors. So, the first one is physiological variable. So, just now we read a scenario. Okay, for that particular patient, okay, now we are going to see, let us say that it is a middle-aged woman around 30-year-old, okay, suffering from this, diagnosed as multiple sclerosis. Okay, and now I am going to assess her physiological variable. Whenever I assess the physiological, each variable, I will have to assess this variable under intrapersonal, interpersonal, and extrapersonal stressor. So the first one is physiological variable under intrapersonal stressor within the body. Okay. Now for this patient is found to suffer from severe headache and vertigo that worsens in light. The patient experiences severe headache, dizziness is there, weakness is there. Walking disorders are due to muscle weakness because the brain is actually starting to degenerate. Okay, the brain is starting to have demyelination. So this patient suffers from muscle weakness, blurred vision, double vision, seizures, heaviness in the head, inability in catching hold of any objects, burning and tingling sensation in the hands and feet, which worsens during an attack. So many symptoms this patient is enduring because of this condition due to neurological damage. So what are the main things we found? Vertigo, headache, weakness, blurred vision, seizures, inability to handle an object, etc. The next thing is coming on to the gastrointestinal system. This patient has loss of appetite, early satiety, weight loss in recent months, constipation, occasional nausea and vomiting. So she is not feeling very well because even her GI system is going to be affected. She has constipation, nausea, vomiting, loss of appetite, and weight loss. Then the next thing is respiratory. So when I looked into her respiratory system, it is found to be normal. Okay, that respiratory system, the auscultation was clear. So she doesn't have any problem in the respiratory system. Coming on to her genitourinary system, she has difficulty in urination and there is dripping of urine. So she suffers from dripping of urine and dysuria. Okay, coming on to her integumentary system, I found that there are red skin with spots on the face. There are sometimes she has scalp irritation, especially whenever she is having that emotional or psychological pressure. Her itching is found to increase. Okay, so that is in her integumentary system. Coming on to musculoskeletal system, there is weakness in arms and legs, there is radiating pain in the shoulder and chest, imbalance and dizziness during attack. So she is having problem in her musculoskeletal system. Regarding her ear, she always feels that her ear is feeling stuffed up. Okay, so there is stuffiness in ear. Coming on to her vision, already I told you there is blurred vision, double vision, okay, fluttering objects in the visual field, reduced visual field, inability to see beyond the distance of 7 to 8 meter. So that is regarding her vision. So these are the main problems found in a patient physiological aspect, intrapersonal stressor for a patient with multiple sclerosis. So what do I understand from this? When I assess a patient according to Betty Neuman's theory, I will have to look system-wise. Starting from each system, I am seeing whether there is any problem for this patient. Whatever is the problem, you are writing it down as intrapersonal stressor. Coming on to the second variable, psychological variable. In psychological variable, I found that the patient cannot express any feelings about her disease, but she is found to be depressed and anxious. She looks tired and bored. So in the beginning itself, it was told that she is feeling highly tired, highly fatigued, and she is feeling lonely, and so she is not able to express, but I find that she feels she is depressed and anxious. She is irritable and mental pressure is there by the patient's husband because always she complains of tiredness. She tries to overdo certain things and that irritates her husband. So irritability from the husband. And that why it is being put under intrapersonal is the person feels that the partner is having irritation. So it is again an intrapersonal stressor. So she needs intense mental family support and she is constantly agitated and anxious because of various family dissociation problems. The third one is socio-cultural variable. So in socio-cultural variable, we find that this lady is highly interested to participate in artistic activities. See, we in socio-cultural variable, we are going to ask what makes you feel calm. what makes you feel good. Maybe when I do certain things, we all feel, whenever we do certain things, we feel really happy, or we feel very peace of mind. Okay, for her, artistic activities helps her to be mentally calm, but she is not able to participate in the sports classes which is arranged for patients with multiple sclerosis due to transportation and distance. So that is one of the socio-cultural variable problem which this author has identified. That is, a patient is not able to participate in the sports classes. Developmental variable. So she is a middle-aged woman. Okay, so let's say if it is a lady who is around 40 years or 45 years or even 50 years, in that case, if I'm going to see, we can say that this patient is successfully engaged in developmental needs appropriate to a middle-aged adult. For example, a 50-year-old or a 54-year-old getting prepared for menopause is considered to be a normal developmental variable. So based on that age, we can find out whether that developmental variable is achieved or not. The last variable is spiritual variable. On examining this particular patient, it is found that she considers herself as a religious person. She believes in God, she prays, and she participates in religious ceremony. So that is about the 5 variables which are being examined in detail related to intrapersonal stressor. So I hope it is not making you get into a confusion. Only thing is, whenever we apply Newman's theory, we have to assess the variable. Physiological, we have to assess all the systems. Psychological, her emotional aspect, what she is perceiving about others. Socio-cultural aspect, ability to engage in a social activity or in a cultural activity. Developmental variable, appropriate to that age or not. Spiritual variable, her faith system, her religious support system. All those things comes under intrapersonal stressor. Now we are going to discuss about interpersonal stressor. Okay, interpersonal stressor means what? The stressor which occurs due to two individuals or 2 or 3 individuals is interpersonal stressor. So I found that this patient is having a feeling of emotional impact because she is away from her family due to long distance. So that is one interpersonal stressor, because she is not able to see her family members or her children very often. The second thing is she is away from children due to remote education place. So maybe she is separated from her children because of geographical reasons or geographical distance. Other than that, we can go for the third stressor, that is extrapersonal stressor. This doesn't come actually under interpersonal, but this particular patient, we can find out whether she is having any extrapersonal stressor, maybe from her job or from her workplace, or maybe is there a stress from her residential area, is there a stress from any healthcare agency. All those things can be put under extrapersonal stressor. So assessment of Betty Newman's theory, we have completed intrapersonal, interpersonal and extrapersonal stressor. So assessment part is over. So assessment, once more I tell you, we have to assess the discrepancies between the patient and the caregiver. Number 2, discrepancies on the perceptions of the stressor between the patient and the caregiver. The second one, I have to assess the variables, 5 variables. Third one, I have to assess the stressor, the 3 stressors, intra, inter, extra. So once that assessment part is over, okay, that is why we say Newman's assessment is a comprehensive assessment. So this much part in assessment, if it is over, next we are going to draw the care plan. Okay, so in a care plan, we have to have certain columns. One is client variable, nursing diagnosis, aim, level of prevention, level of prevention, interventions. Okay, so I'll show you. Now, for this particular patient, when we draw a care plan, if needed, we can even draw one more column to the right of intervention as evaluation. Okay, so this is how we are going to write it. That is a variable, the nursing diagnosis, the aim. See, instead of the word assessment, we have put the word variable. Okay, then we are going to write nursing diagnosis as usual, aim as usual. In plan of action and intervention, there is one extra word which is written here, that is level of prevention. Level of prevention. And next is intervention. after that evaluation. So first, let us see for this particular patient, the variable we are going to talk about activity intolerance. Okay, activity intolerance. For that, the variable is physiological variable because it comes activity, inability to tolerate an activity comes under physiological variable. So the variable what we have to write here is physiological variable. Nursing diagnosis, what the author has written is not tolerating any activity. For exam point of view, you can write even Nanda's nursing diagnosis as activity intolerance related to weakness, fatigue and irritability. So that we can write here as nursing diagnosis. As usual, the aim, okay, helping the patient to carry out the activities. Usually how we write is, she maintains optimum activity or she is able to perform optimum activities within limits as evidenced by, right? So that can be written as aim. Next is level of prevention. Level of prevention, already the patient is suffering from activity intolerance. It is not a primary prevention. So it comes under secondary prevention. So level of prevention is secondary. What are the interventions? The usual activity intolerance, the interventions what we write. Avoid exposure to environment with high temperature because these patients, they cannot tolerate heat. They cannot tolerate heat. Okay, multiple sclerosis. So make sure that they are avoiding exposure to environment with high temperature. Avoid taking hot shower. Avoid eating heavy foods. Avoid doing too many activities. Avoid hunger and stress because all these things can exacerbate the fatigue. Then the other interventions are helping the patient to engage in exercise and sports such as swimming, even simple gestures as tolerated, reduction in ambient noise because all these things will drain the energy of the patient and the patient will feel still more irritable. So avoid or reduce the ambient noise, avoid too much work, avoid too much work and tell the patient to rest in between the work and to get adequate sleep. Still, the interventions are teach the patient about energy saving techniques like sitting while taking a shower or while brushing your teeth because these patients are extremely tired. So we can teach them energy conservation techniques. Cold shower. I told that they are not able to tolerate heat. So cold shower, sucking ice, wet towel whenever they are feeling hot. So this is how we write a care plan according to Betty Newman's theory. So the first part is assessment. After finishing the assessment, we have to draw the care plan. So instead of the first column assessment, I am going to write here which variable is affected because already assessment is over. Detailed assessment is over. So now I am going to write the variable, the nursing diagnosis, the aim, one extra column which comes is level of prevention, intervention, evaluation. So that is how we have to write. Now for this evaluation, what we can write is maybe the patient mentioned technique she was taught to maintain her energy level. She became aware of the importance of resting in between the activities. She stated she would consider resting in between work. So the patient has got an understanding that she has to pace herself in between the work. So the other nursing diagnoses which are formulated are disruption of the concept of self because the patient is feeling depressed. So that self-concept disturbances associated with the disease, decreased muscle strength, power and weakness. Stress and anxiety associated with being away from children, family, disease and aggression of the spouse. Now all these things from where am I formulating? From the assessment. From that 5 variables what we wrote in detail, from that I am writing the nursing diagnosis. Then eating disorder, maybe we can write it as imbalanced nutrition, less than body requirements. So eating less than what the body needs and because of anorexia and nausea. Risk of trauma and falls because this patient is having blurred vision, patient is having double vision, she is not able to see beyond 7 meters. Okay, so the reduced vision field, so there is a risk of trauma and falls. She is also suffering from vertigo, so we should be very careful. So there is a risk of trauma and fall. Disturbance in bowel movements, we found that in the assessment she is suffering from constipation associated with illness, weakness and disability. Changes in sexual pattern because of fatigue and depression. Disorders in sleep pattern associated with an urge for urination. We found that she is having dripping of urine Okay, she's having urinary problem. So disorders in sleep pattern, urge for urination, headache and flushing, disorders in reading and writing because of the visual disturbance and the vertigo. Impaired skin integrity, we found that in the integumentary system there is a lot of spots in the skin, and she's taking a lot of medicine. So impaired skin integrity associated with drugs, urinary dysfunction associated with the disease, and the bladder nerve damage. Avoiding loneliness associated with being away from children and family. So it's a wonderful nursing care plan which is being written by that particular author. As I told you, it is available in the website, where a comprehensive assessment is being made, and based on the assessment, so many nursing diagnoses are being formulated. Now, I have given an example, I have showed an example of how to write a physiological variable with secondary intervention. Now, let us see an example of writing a physiological variable with a primary intervention. So, the example is this: risk of trauma. So, it is always risk for injury, risk for trauma. So, it is the trauma has not yet occurred. So, the intervention what can be used is primary intervention. So, for this physiological variable is risk of trauma. So, we write the nursing diagnosis, write the aim that what to say, the patient, she will be free from injury or avoiding trauma injury, controlling the situation during weakness. So, this primary intervention, let us read what is being written over there: availability of necessary supplies, avoiding any disorganization because the patient can tumble and fall, using appropriate shoes and slippers, very important that a person should wear shoes with proper size and proper grip. Otherwise, a person with vertigo, a person with muscle weakness can easily injure themselves. Sufficient light should be available. Keeping calm and avoiding rush during work. Okay, avoiding abrupt changes in a situation to avoid dizziness. The patient should be taught to sit whenever she is having an attack of dizziness. So this is an example of a physiological variable using a primary intervention. So the evaluation is the patient's awareness of measures to avoid trauma caused her to avoid walking during vertigo attacks and to sit down until she is feeling better. Now, one more last example is we are going to see about the psychological variable with secondary intervention. So, the psychological variable is avoiding loneliness. We found that this patient is suffering from loneliness. So, that is her problem, loneliness. So, what can be done? Encourage phone calls with children, encourage to participate in sports and arts classes, encourage to communicate with neighbors so that, or even with caregivers, okay, so that she is able to come out of that feeling of loneliness. Now, the evaluation is according to the patient's statement: she had the enthusiasm, she had the interest to continue to participate in the training classes, and she felt lonely whenever she is not attending the training classes. So the patient has got such an understanding that how to avoid this feeling of loneliness. Now let me tell you one more point. Whenever we write a Newman's theory nursing care plan, okay, you can write like this. That is, you assess all the variables. For a practical exam, detailed Betty Newman's theory nursing process, if you are planning to apply, what you should do is first write the assessment. Assessment, write it separately. Okay, don't put it under the column because it is such a comprehensive assessment. So from an exam point of view, what you can do is you can just take down the assessment, write the heading as: first you can assess the stressor as perceived by the patient, stressor as perceived by the caregiver, write the summary of impression. Then what you're going to write is intrapersonal stressor heading. Under that physiological, that 5 variables, each thing you assess in detail. Okay, then what you can do is you're going to see whether there is any interpersonal stressor, then any extra personal stressor. After doing a complete assessment, what you're going to do, you're going to draw the columns. Which variable is affected? What is the nursing diagnosis? What is the aim? What is the level of prevention, the interventions, and the evaluation. One more way how you can write this intervention is it is available in Julia B. George's textbook. That is, for each, say for example, if it is going to be a problem with breathing difficulty. Now, for this breathing difficulty itself, we may use primary intervention, secondary intervention, and tertiary intervention. So, in that Julia B. George textbook, it is given like this. Intervention is divided into three columns: primary, secondary, and tertiary. If you want, you can write like that. Otherwise, whenever you write an intervention, write primary, write down all the points. Secondary, the next column. What I mean to say is this. Now, here I have written secondary. Okay, secondary. See, these points are secondary. Okay, then what I can do is, if needed, I can write it as primary. And if I am going to write something, that points can be written here. So these are the ways how you can apply Newman's theory in nursing process. So overall, there may be a confusion based on our 5 steps nursing process, 3 steps nursing process according to Betty Newman, and how we are writing. Nothing to be confused. The usual conventional nursing process is this: assessment, nursing diagnosis, goal or objective. Whenever we write for an exam, we have a plan of action, implementation, and evaluation. According to Betty Neuman, assessment nursing diagnosis is coming under the first step, nursing diagnosis. The goal or objective is going to come under the second step, nursing goal. Implementation and evaluation is going to come under this step, that is outcome. Then when I write a care plan, assessment, I am doing a comprehensive assessment in detail. Then what I am going to do is nursing diagnosis step only, this variable, that is which variable is affected. Is it physiological? Is it psychological? Write the nursing diagnosis. Goal is coming under aim. In outcome, we have this prevention level, the intervention, and the evaluation. So this implementation is actually prevention and prevention level, and the intervention. Evaluation is evaluation. I hope it is clear. So if you have this idea, if this part is clear to you, it's very easy to apply Betty Newman's theory. So once more, I'll tell you 3-step nursing process, Betty Newman. But in that, our 5-step nursing process is clubbed together. In the first step, we have assessment and nursing diagnosis together as nursing diagnosis. Second step, goal is our nursing goal. Implementation and evaluation is outcome. If you're writing a plan of action, that also will come under nursing goal. That's it. Okay. So variable, nursing diagnosis. See, whenever you apply a Newman's theory, when an examiner is seeing a care plan, what we should see is whether variable is there, whether the stressor is being identified, whether the prevention level is there. 3 words. Whether the variable is there in the care plan, whether the prevention level is there in the care plan. Have you written a word about intra, inter, and extra personal stressor? If these 3 things comes in your care plan, then it is well understood that you have applied Betty Newman's theory. Now, just for a brief discussion, 2 to 3 minutes discussion on heart failure. If the same scenario is put for a heart failure, the same scenario I have explained in Roy's adaptation model. Now, for this particular patient, Mr. X, who is a 70-year-old widower experiencing dyspnea, experienced orthopnea, fatigue, PND, and leg swelling, admitted to the hospital for the problem last year. Known case of heart failure, diagnosed with hypertension. See, all these things are the physiological variables. Okay, the physiological variables coming as intrapersonal stressor, experiencing orthopnea, tiredness, paroxysmal nocturnal dyspnea, pedal edema or leg swelling, uncontrolled hypertension. Okay, pedal edema, bibasal crepitation of the lungs, left ventricular hypertrophy, high blood pressure 160/100, irregular pulse rate. All these things are the physiological variables which comes under intrapersonal stressor. So when I write an intervention, most probably it is going to be a secondary intervention. All these things what I'm going to write here is secondary intervention. Okay, maybe the primary intervention is I'll be worried about impaired skin integrity, whether the patient will end up with some respiratory distress. Okay, so that comes under whether there is any risk for acid base imbalance, risk for decreased cardiac output. All those things are primary level intervention. Now what I have written here, these highlighted colors are, they are physiological variables with secondary level of prevention. then we have a burden, becoming a burden to his children. So it's a psychological variable. It is a psychological variable. Okay, maybe he feels inadequate. He feels inadequate as he is unable to play. So is that that is actually giving an angle on the psychological variable. More data is needed to comment on his spiritual variable, socio-cultural variable, and developmental variable. Okay, so once I have completed with this, what I'll have to do, draw the columns. First, I will write whether it is physiological, psychological variable, nursing diagnosis, the objective or the aim, the level of prevention as we just now discussed, whether it is primary or secondary, and then the implementation and the evaluation. So that is how beautifully you can apply Betty Newman's theory. Okay, so nursing process according to Betty Newman's theory, when we actually look, it is like this. Okay, it may you may feel it is very complicated because you talk about five-step nursing process, you're talking about three-step nursing process according to Newman. When you're writing, again you're writing it little bit differently, but be very clear. Okay, three things should be there when you write a Betty Newman's nursing process. Number one, your care plan should reflect the variable. Second arrow mark, your care plan should reflect the stressor. Number three, your care plan should reflect the prevention, level of prevention interventions. Is it primary, secondary, or tertiary? If these three things are highlighted in your nursing care plan, be confident you are on the right track. You have applied Newman's theory properly. For an assignment when you're doing, like for advanced nursing practice, you have to write a theory based care plan. It's such a beautiful theory to apply for a particular patient because you're doing a comprehensive assessment and you formulate so many nursing care plans and you can give a complete care to the patient. So I hope this video is clear. Okay, so we have discussed so far regarding how to apply Betty Newman's theory in our nursing process and how to give a theory-based care to the patient. I hope it is clear. So I wish you all a very happy Christmas and advanced Happy New Year. And thank you very much for your great support and encouragement. Thanks a lot for watching my video.